What can be done when we see that kidney damage has already started?
So normally these painkillers are taken every 8 hours or at the most every 6 hours. The more you take, the more is the likelihood of causing kidney injury. These painkillers are also bad for the lining of the stomach. And these painkillers can damage the stomach mucosa, which in turn can cause severe pain while you eat food. And in some people, the injury may be so much that you might start vomiting blood. So painkillers are bad both for the stomach as well as for the kidney. If your kidney injury has just started, then you can manage their kidney lifelong if you take proper care. Once the kidney is damaged, as a consequence, you tend to develop high blood pressure. This high blood pressure will further affect the kidney and sets off a vicious cycle. You can break that vicious cycle by a good control of blood pressure. Then, as I said, if your kidney injury is somewhat more, then try and cut down the load on the kidney by cutting down the intake of proteins in your food. And therefore, to those who are non-vegetarians, we tell them that you cut down the portion of non-vegetarian food, or if you can do without it, it will help the kidney. As I said already, try and avoid painkillers of the class called NSAIDs because they are definitely going to damage a kidney which is already compromised in function. We also suggest not to take any medicine about which we do not know because those medicines can further damage the liver. And finally, it is very important that you periodically check what is happening. Unfortunately, kidney disease gives no symptoms. It's a silent killer. And therefore people feel, I am feeling okay, I am passing urine well, everything is fine. You will not come to know until the kidney disease becomes far advanced. So periodically keep checking your kidney function. So the two most important parameters we check are the level of a substance called creatinine in the blood. Normally this creatinine is produced in our body and at the same rate it is removed by the kidney. The creatinine comes from the muscle mass. If his creatinine is 1 or 1.2, if he stops eating non-vegetarian food, his creatinine will come to 1 just because his production of creatinine is less. Similarly, if someone is a muscular person weighing 70-80 kg and for some reason he loses weight and muscle mass, his creatinine will come down, but that is not because of better kidney function, because of less production of creatinine. So understanding creatinine is important and monitoring it regularly. That is a very useful parameter to understand how your kidney is doing. The other important parameter is a simple sonography. The sonography will tell you what is the size of your kidney, what is the appearance of the kidney, we call it echo texture, and that can tell you what is the kidney function likely to be. So if you monitor this periodically and depending upon the degree of dysfunction, if it is mild dysfunction, we will tell them monitor it every 3 to 6 months. If it is a moderate degree of dysfunction, we tell them you must monitor 3 monthly.